All right, good afternoon, everybody. My name is Christina Clayton. I am one of the co-directors for the MHTTC here in the Northwest region. Very, very happy to have you join us. Just wanted to let you know that we have a great presentation today and just a few things that we will review as we go through the slides. So today we're going to be hearing about skills for psychological recovery, or otherwise known as SPR. And just want to say, on behalf of the Northwest Mental Health Technology Center, we're really excited to have you. We have folks from the Trauma Recovery Innovations at University of Washington, and you'll learn more about the speakers in just a moment. The MHTTC network is a nationwide network that is supported by the Substance Abuse and Mental Health Services Administration, SAMHSA, with the purpose of disseminating and implementing best practices for the mental health workforce. Oops. Pardon my Zoom is having issues. Trying to get to my next slide. I'll go like that. There we go. The Northwest MHTTC is based at the University of Washington in the Department of Psychiatry and Behavioral Sciences. We provide training and technical assistance to the Region 10, which is Alaska, Idaho, Oregon, and Washington. Our goals are broadly to accelerate the adoption and implementation of evidence-based and other best practices, heighten the awareness, knowledge, and skills of the workforce, foster alliances among our community, and ensure availability and delivery of publicly available free of charge training and TA like today. How we do that is through a variety of means. We have online courses, we have website with events, products, and news and resources. We have live training like today. All of our webinars typically are recorded and archived, and we also do research and practice briefs. Just a disclaimer, we could not do this without the support of SAMHSA, and of course this content is not reflective of any official SAMHSA position. Little bit about language. It's our intention to always be mindful of using language that is promoting recovery and culturally appropriate, and we encourage everyone to use and champion person-first language, which emphasizes the individual, not a condition or diagnosis. Now, a little bit of logistics. So as you know, we're a pretty large group, so everyone is muted by default. And so you'll see on your screen ways to communicate with us. So on the technical side, you can share things in the chat box, and we'll share things with you about logistics. Let us know if you're having technical issues. And this will only be visible to our team. If you have a content question, we're asking that you please use the chat, the Q&A options. So you can put it into the Q&A box there, or you can raise your hand. So I have the wrong thing highlighted on that little icon I just noticed, but you're going to click the Q&A box and then type in your question, and someone from the presenting team will take a peek at those and monitor those and either type in a short answer or get to the discussion at the end. We, on the technical side, are not able to move questions that you put in the chat. So if you do ask a question in the chat, we may ask you to please move it over to the Q&A, because that would be helpful for us. And then after, I just want to say we really, really value your opinions. So your feedback really helps us know how things went today, how they were received, keeps the free trainings coming, and it's confidential, only takes a few minutes, and we'll share the link by chat, and as well as you get a reminder by Zoom. And we are required to conduct the survey. We appreciate you taking a couple minutes to do so. And now I'm very happy and grateful to introduce our presenters from the University of Washington Trauma Recovery Innovations Program within the University of Washington Department of Psychiatry and Behavioral Sciences. We have a lot of content and really great presenters, so I'm going to let them get to the good stuff. Thank you so much.
Thank you, Christina. I'm going to get us started. So just give me a couple of seconds to get my slides up, and then we'll jump right in. Okay, can someone just confirm, someone from the panel just confirm that those are showing up okay and that you can see my slides? Thank you, Emily, the thumbs up, and also that my microphone sounds okay as well. Yes. Okay, great. Thank you so much. I appreciate it. So as I briefly mentioned, I'm Michelle Bedard-Gilligan, and I'm really excited to be here today along with Emily Dworkin and Kristen Lindgren. As Christina mentioned, we are coming from the University of Washington, where we all serve as faculty in the Department of Psychiatry and Behavioral Sciences. And together we make up the Trauma Recovery Innovations Program, where our main mission is really to study and better understand recovery following trauma exposure, and understand risk and resilience factors following trauma and ways that we can better help people recover following exposure to adversity. And we're going to be presenting today specifically on a model called Skills for Psychological Recovery, which is a model that we use in the kind of acute aftermath or the very beginning aftermath of exposure to traumatic events. And so we're going to be talking today about the background for what's termed SPR, as well as how we deliver SPR, because it is an intervention model. Oops, sorry. It's the slides here. Great. As we're getting started, I first want to give a couple of acknowledgements. So we did not develop SPR. We are not the treatment developers of this. We are simply disseminating and trying to get the information on how to do it and what it is out there to people who might benefit. So SPR is adapted. The information we're presenting today is adapted from previous work done on SPR. So work done through the National Center for PTSD and the National Child Traumatic Stress Network. Both of their websites have much more information on SPR, including field operations guides, which are full treatment manuals, as well as some additional training materials. We also want to give our thanks to our Department of Psychiatry and Behavioral Sciences at UW. We would not be able to do work without the work we do without their support. And particularly, we have a handful of individuals here named Molly Forrester, Rebecca Sladek, and Rosemary Whitwright. We name those individuals specifically because they've been incredibly integral to helping us develop the materials that we're going to present today, and in supporting us in the work we're doing to help people learn about SPR. A brief outline of what we're going to be covering in today's webinar. So we're going to be talking about the background of Skills for Psychological Recovery, which is abbreviated SPR. We're going to be talking about the background around it and why we think it's helpful. We'll be talking specifically about the different components and structure that make up SPR. And then we're going to be talking about the strategies that SPR includes. So strategies around assessment and planning, strategy around teaching skills that are embedded in SPR, as well as application, so how we apply it with different people that we might be working with. And I'm going to take us through the first couple, looking at the background, the components and structure assessment, and then Emily will be taking over with the skills and the application. Okay, so Skills for Psychological Recovery. Let's start with some background about what SPR is, what it isn't, and where we think it's most useful. So we are all in the midst of a crisis. The 2020 in and of itself could be considered a crisis in many ways. And certainly many of us have been exposed to more adversity in the last year than is typical for us. Of course, we are all dealing with COVID-19, which has been a really significant stressor. But there's also been a number of other significant crises and or stressors that many of us are experiencing and weathering right now. So increased awareness around anti-Black racism, which of course has been something that's been present it's not new, but increased awareness of the effects of anti-Black racism, systemic racism against marginalized groups more generally, increases in stress around financial or economic circumstances, civil and social uprising and unrest, political conflict and volatility. This is just some of the things that many of us have been dealing with in 2020 on a level that is increased from maybe what is typical for us. And so we're all being kind of put through this period of increased stress. And because of the kinds of stressors that we're all being exposed to, we really have to remember that these are stressors that go up and down. And so we're sort of within this ocean where these waves of stressors keep kind of hitting us again and again. And there'll be periods of calm, and then another wave will come and we'll experience an increased period of stress again. And we've been weathering this for a while now. So it's been months in terms of many of us feeling like we're dealing with very significant stressors, really beginning with COVID-19 in February or March.
and just I think we think it's really important that while we acknowledge how difficult this has been and how challenging it has been for many of us and for many of the clients and patients that we might work with, we also have to acknowledge that during periods of adversity, the most common outcome really is resilience. And what we mean by that is that for most people, we will weather the waves and the storms, such as we are during 2020, in a way where we can come out at the end with an ability to move forward, with an ability to keep going and to keep coping. We can adapt to the stressors as they come, and we can get through them in a way where we don't see significant decreases in our functioning, or we don't see significant impairment in our functioning. And we know that for most of us out there at a population level, resilience really is the most common outcome, and it is the expected outcome. And that being said, we also know that with these chronic stressors that are punctuated by these periods of increased acute stress as these things come and go up and down, that we do need to adapt, and we need to learn skills to be able to weather these sort of spikes in stress that we're all going through. And so, SPR is one way that we can help people learn skills to do this, because we're all going to need to adapt, and we're all going to need to learn new skills to be able to get through these periods of adversity. And it's important to note that what we're talking about here are skills explicitly aimed at an individual. So things that individuals can do in order to build resilience and to be able to weather adversity in a more effective and adaptive way. It doesn't replace the need for system support or structural support. It is just one approach in terms of helping individuals become as resilient as possible to really kind of cope with the adversity and the stressors that we're experiencing. It's also important to note that resilience, although it is the most expected outcome, and it is the most common outcome, it's also not neat and clean. With resilience, we are not necessarily talking about the absence of distress. In fact, most of the time, we are definitely not talking about the absence of distress. We think of resilience as something that is actually very variable and very nonlinear. So resilience doesn't mean no bad days, and it doesn't mean that things feel easy or even stable or even good. It certainly doesn't mean that we don't have periods of distress. It just means that we are able to adapt and get through them in a way where ultimately we come out, at the end, perhaps changed and perhaps affected, but doing, relatively well and as well as we were doing before the stressor and the adversity happened. It's also important to note that resilience is something that can be learned and acquired. It's not a trait that we have. I think sometimes we think about people as being resilient or not, and that's not actually correct, and that's not what the data shows. We can learn and acquire skills to make us more resilient and more able to weather the stressors and the adversity that comes along. And resilience takes persistence, and it takes a lot of effort, and it takes a lot of intentional effort. And so there are ways that we know that we can actually teach individuals the skills necessary to help facilitate their resilience and help facilitate their ability to cope short term with adversity that comes up, so that long term they are adjusting in an adaptive way. And so this is a continuum of approaches that we think of as approaches that help build resilience and help build individuals' ability to cope with adversity and stress. And different approaches are going to be indicated depending on both the timing and the severity of the stressor or the adversity. So at the top here, we have psychological first aid, which we did a previous webinar, which some of you might remember, and skills for psychological recovery, which is the one we're talking about today. And these are approaches that are really meant to be resilience building programs. So they are approaches that are meant to be delivered in the acute early stages of adversity or stress. And so psychological first aid is actually sort of the first line. That's the thing that we do before stabilization has even been achieved. It's an approach where we can help stabilize people during or in those initial hours and days after a crisis. Skills for psychological recovery is where we are more now. So Skills for Psychological Recovery is a resilience building program that's really meant to be done in the early phases, so the days and weeks after a crisis, but it's meant to be delivered when some degree of stabilization has been achieved, and we're helping the individual kind of tolerate the ongoing effects of the crisis and the adversity that they might be experiencing. And then at the the bottom end of the spectrum, we have what we cognitive behavioral therapy for mental health disorders. So these are the evidence-based approaches that we know work for kind of longer-term psychopathology or mental health disorders that can develop following adversity or stress. And we're focusing on SPR right now because we are in that stage where the stressor is become chronic. There's still these periods of acute ups and downs, but we've developed a sense of adapting to the new normal or the new world that we're living in. And so we're in that phase, that sort of intermediate phase where resilience building is still really crucial, but we've achieved some level of stabilization. And we think of both psychological first aid and skills for psychological recovery as being what we'd call evidence informed, meaning that they don't have as much research testing their efficacy in terms of kind of really hard, robust, randomized clinical trial evidence, but they are based on strategies that have a wealth of evidence behind them as being effective. An SPR, like I said, is really an intervention that's meant to promote resilience. And the goals of SPR really reflect this focus. So the goals of SPR are around protecting mental health. So protecting an individual's kind of underlying mental health while they're sustaining the crisis. Enhancing individuals' ability to address one's own needs, so building their self-efficacy around being able to solve their problems and to help cope with the distress and the difficulties that are coming up because of the crisis. It's focused on teaching skills to help promote recovery, so to help promote a skill-based, or it helps to learn a skill-based approach to help recover from any kind of symptoms or dysfunction that might have been caused by the recent stressor. And then it's aimed at trying to prevent the development of maladaptive behaviors. So to keep the individual from developing behavior patterns that could in the long term contribute to the development of longer term psychopathology or increased impairment. And so we think of SPR as an approach that really can be used to promote long-term resilience. So the skills are helpful in helping to build an individual's capacity to be resilient to the surges in stress, the surges in distress that happen along with the stressors, so that they can face the crises with what feels like a tolerable level of distress and continue moving forward. And SPR is not a treatment for mental health disorders. So we don't think of it as therapy. We don't think of it as necessarily focused on psychopathology or mental health disorders. It really is about dealing with these reactions that most of us are having and helping the individuals who need more scaffolding around learning the skills that they can use to cope with those negative reactions that are occurring for really good reason, so that they can be resilient and not end up on a trajectory where they're more likely to develop psychopathology or longer-term mental health disorders. So, with that definition, it's probably implied, but SPR is not a psychodynamic or a psychoanalytic type insight-oriented exploration. It is very skill-based, present-focused, and in the moment. And it is not psychological debriefing. So for those of you who are familiar with that approach, that has been shown to actually be unhelpful in the immediate aftermath of a crisis, it is not that. Psychological debriefing is focused on reliving, explicit details, often in a group setting, and it's actually been found to have kind of iatrogenic or unhelpful effects. And SPR is explicitly not that. It is based on skills that one can learn to tolerate the distress and the thoughts and the emotions that they're having, but in a way where it's individual focused and helps them to move forward as opposed to getting kind of stuck in the past. And SPR has really, because of these kind of components around what it's not, it's really a good approach in that it's something that we can train a wide range of providers to do, and something that we can integrate into a wide range of settings as well. And as we talk through the nuts and bolts of SPR, I think you'll see why. SPR is also one of the real kind of benefits of an SPR approach is its flexibility. So I mentioned that it's evidence informed and it's based on a number of things that we've shown throughout the years to be really helpful in terms of building resilience. And it's also designed to be delivered flexibly. So it takes those things that we know work and gives flexibility to both the provider and the person receiving SPR to integrate the things that are going to be most helpful to them, and without having to do a set number of sessions or a set number of kind of strategies. As I mentioned, it's based on research around trauma, risk, and resilience, and it is broadly applicable in a variety of settings. It is appropriate for people and families across the lifespan. So Emily, Kristen, and I mostly exclusively work with adults. That being said, there is specific SPR strategies that can be tailored for kids and families, and there's more information on some of those websites that I talked about at the beginning around how you would do that. And SPR is also by definition very culturally aware. So because it is flexible and individually focused, it can be shaped and designed around one's culture and what fits into their specific context of their life and the world that they're kind of interacting in a way that can be most beneficial for that person. And just like any other intervention or approach that we're using, SPR is appropriate for many people, but not all. So people in chronic phase of crisis is generally where we're looking at implementing SPR. Individuals who are a danger to self or others, or individuals who are experiencing psychotic symptoms or severe cognitive disability are likely more appropriate for a higher level of care, perhaps with the CBT for mental health disorders that I mentioned earlier, or some kind of pharmacology management or something. But SPR is really meant for people who are struggling, but just need help in terms of building skills to get through the crisis. And SPR explicitly draws on factors that we think underlie kind of effective interventions on the whole. So things like good listening and clinical skills, which are really crucial, particularly when an individual is withstanding, in the midst of witstanding adversity and stress. So strategies such as active listening and providing empathy and validation, being strength focused and really emphasizing what what positive coping strategies or positive attributes an individual has and helping them figure out how to harness those in response to the current stressor. And then finally, as I mentioned, being extremely culturally aware and exercising cultural humility around wanting it to apply to the person and the context in which they're operating. And so all of these things are kind of woven throughout the SPR approach in order to make it sort of individualized, flexible, and as helpful to the person as possible. And you can probably tell already, if you're familiar with cognitive behavioral therapy, that SPR does have many similarities to CBT or cognitive behavioral therapy. So as I mentioned, it's focused on the present moment and really emphasizes skill building, things that we see consistent in our CBT therapies. It also makes an assumption that thoughts, emotions, and behaviors are connected. And so it makes an assumption that intervening on thoughts, emotions, and behaviors will ultimately affect the other parts of that triangle. And so it, just like CBT, it really is focused on building skills around those three areas. Okay, so that's some background on SPR. And what we're going to do now is actually talk about the components and the structure of SPR. So SPR always begins with an assessment, and this is a cornerstone of SPR. Because it is this individually flexible model, it's really important that at the outset of SPR that we have a good assessment and a good understanding of what the individual's needs and concerns are. In the midst of a crisis, there's often a lot of priorities that an individual has and often a lot of competing priorities. And so an assessment is really focused on understanding what are the top priorities for this individual right now in this stage of the crisis that they're in, as well as then tying this assessment to be able to help the individual collaboratively come up with an action plan of how we're going to apply SPR and put it into action for that person. And SPR includes 5 individually tailored skill modules that are flexibly applied. And so it's usually done with 1 skill per session with an explanation of the rationale for the skill, the teaching of the skill, and then some sort of assigned practice. And we'll talk much more about all of those things in a minute. But the 5 skills are around building problem-solving skills, promoting positive activities, managing reactions, promoting helpful thinking, and rebuilding healthy social connections. And again, you can probably see some overlap and similarities with CBT approaches in terms of the types of skills SPR uses. And, the course of SPR is flexible, as I mentioned, but there also is a degree of structure there as well. And so each section is sort of structured predictably, I would say. So in a first session of SPR, you're always focusing on introductions. If this is your first time meeting the individual, doing, like I said, a really thorough assessment and planning of what are the priorities that you're going to work with SPR for the person, and then teaching and practicing a specific skill that meets those priorities. And then you're scheduling follow-up sessions. So these follow-up sessions are going to be, again, very predictably structured. So you'll review the homework from the previous session, reassess where they're at and how they're doing, and then give a rationale and teach and practice a new skill. And this will be done sort of for as many sessions as you and the person have decided is needed. And so usually it's 1 to 5 sessions. So there are 5 skills. And so if you are doing a flexible application of SPR, where you're going to do all 5 skills with the individual, then you'd be doing 5 sessions, 1 skill per session. But you may also, with an individual, decide that their priorities are such that they don't need all 5 skills, and you might be prioritizing only 2 or 3 of the skills that I presented, and then you'd be doing only 2 or 3 sessions as needed. And each session lasts for about 45 to 50 minutes, which is kind of a standard therapy session length. So the first SPR session, as I mentioned, is really focused on introductions and introducing yourself, and then also the SPR model. So talking through a lot of what I just talked about in terms of how it really is meant to build resilience and teach skills and increase self-efficacy, and how it's something that is tailored to be done in the midst of a crisis or in times of adversity. You're also doing a collaborative assessment and selecting collaboratively with the individual what skills are going to most meet their priorities. Then you're going to teach that new skill. So you'll present the rationale for the skill, you'll teach and actually practice the skill in session, and then you'll assign them homework where they summarize the skill. You'll summarize the skill for them and discuss follow-up and how they're going to get that homework done and when they're going to return to talk, about that experience. And then the follow-up SPR sessions are around, each one will start with a review of homework, followed by a collaborative assessment and skill selection for the next skill that you're going to teach. You may end up using the same skill, so you may assess that they need more practice or more help with the skill you previously taught, in which case you may be teaching that one again around the rationale, applying the skill to a new domain and assigning homework, or you'll be teaching a new skill. Well, you'll present a rationale for a new skill, teach and practice that skill, and again, assign homework. And again, it ends with a summary and a discussion of follow-up in terms of when you'll see the person next and what the plan is for them between sessions. And what we're going to do now is actually talk about these various stages. So we're going to talk in depth about the assessment process according to SPR and then start to present each skill. So within an assessment, the goal here in SPR with the assessment is really to be able to identify the needs and concerns that the individual is presenting with. So we're providing a rationale to the individual around that, being really explicit that during times of a crisis and during times of adversity, that most of us have numerous demands and concerns. And so we're going to spend the first part of SPR really gathering the information to understand what they most need and how we can best target our SPR skills to meet that need. In addition, with this assessment, one of the first steps is that as the provider of SPR, you're going to be thinking about whether the person needs, if what you have to offer with SPR is in fact a good fit. So you'll be trying to understand what are the person's main needs, concerns, and priorities. And are they, what kind of SPR skills are going to best fit those? But you're also going to be thinking about whether or not the person might need a referral, whether they need a higher level of care or a different type of care than you're providing with SPR. And when we're thinking about making referrals, and this is just some examples of when we might be thinking about making referrals. So you can see that the second 2 on there, the safety needs and the acute psychosis or cognitive impairment, are things I already mentioned as being things that aren't such a good fit for SPR. You also might be, if the primary concern is more around physical health, you might be thinking about a referral, or if the individual is actually presenting with an acute mental health disorder. So if there's a clear diagnosis of a mental health disorder as opposed to just difficulty coping with the current adversity, then we'll be thinking about a referral there as well. And it's important to know resources. So when you're sitting down to do an SPR session with someone, keeping in the back of your head that, what am I going to do if this isn't a fit? What referrals do I know of? What resources do I know of? Or if I don't know of them, who do I know that could help me come up with them? Because, especially in the midst of a crisis, we want to make sure we take every opportunity we can to connect people with what they need. And so if it's not SPR, really having something in your back pocket for what else could you give them. But assuming you do move forward with SPR, you'll be really working with the individual to understand what are the areas that we need to prioritize as the most important things that we should address. So you're going to be thinking in your head and also asking the person questions around, what are the things that are bothering them the most right now? What are the problems that seem to be getting worse, not better? Is there a problem that if we dealt with it, it would help with other problems down the road? Is there one we need to deal with sooner rather than later? There's some urgency or acuity there. Is there something that you need help planning for or preparing for? And then finally, also, what does the individual want to work on? What are they motivated to get in this time of crisis that they feel would really help them move forward? And so these are just some of the things that we would be considering when we're thinking about what to prioritize with SPR. And then we're going to be talking with the individual about those things and collaboratively trying to make an action plan. So collaboratively coming up with the areas of priority and then thinking about what are the skills that would best fit those areas of priority, and working with the person to choose the most appropriate SPR skills from the 5 that comprise SPR. You're also going to be agreeing on a tentative number of meetings. So you and the person you're delivering SPR to will be thinking about, okay, so we're going to work on 3 skills. So we probably are going to be planning on meeting 3 times over the next 3 weeks to really kind of learn and implement these skills, or whatever the plan was for that person. But you'd be really explicit and collaborative around it. And then, like I mentioned, you'd be making referrals if needed. And this is a tool that we, and by we, I mean Emily, we come up with to help providers of SPR think about what are some of the skills that we would be selecting. And it is adapted from something that is on previously published SPR materials. I think this is adapted from the National Center for PTSD materials, but we've put it in a slightly, what we think is more user-friendly format. But thinking about what are some of the concerns that people are going to present with during times of adversity and stress. And then what would be a primary skill? So what would be a skill that would be sort of first line from an SPR model in terms of helping them improve that concern? And what would be a secondary skill? So something that we might be as a kind of our second line of offense. So for an example, an individual might come in with really intense or repeated upsetting reactions. So they're having a lot of difficulty managing upsetting memories from something that happened to them during the COVID-19 crisis, for example. And one of the SPR skills is primarily around managing emotional reactions. And so that might be the primary one that we're thinking of. And a secondary skill might be more around social connections or helping the individual think differently about some of the reactions they're having. Another example might be an individual who comes in feeling really depressed, sad, or withdrawn. So they're struggling a lot with the isolation that comes with COVID-19. And so some of the primary skill we might be thinking of might be around sort of healthy activities, promoting positive activities. And then secondary might be around kind of problem solving or increasing social connections. And so this is just, like I said, sort of a reference guide to help us think about what are the concerns and how do they map onto some of the skills. But you and the individual you're providing SPR to will be talking through options and thinking about what skills seem the best for their given concerns. Okay, so and that's the first part of the first session. And then the second part is once you have come up with their primary concerns and the skills that you're going to select to use during SPR with them, you're really going to then shift to thinking about what are the skills, how to implement the skills themselves. And so that's what Emily and I are going to be spending the next period of time talking about. I'm trying to get into details about what each of these skills looks like and how you might use it with someone who presents for SPR. So the first skill we're going to talk about is building problem-solving skills. And problem-solving skills are those that we think of as helpful when an individual is really struggling to figure out how to most adaptively cope, approach, deal with the myriad of problems that might be coming up because of the crisis or the stressors that they're under. And so individuals who are reporting feeling really overwhelmed by the problems that they have in their life, or feeling like they have no control over solving the problems in their life. They report maybe feeling helpless or demoralized, like they don't see a path forward in terms of changing their circumstances, whatever they might be. This would really be when we'd be thinking about using utilizing a problem-solving skill from SPR. And so what we're going to actually do to illustrate the problem-solving skill is use a case example. So in this case, it might be a case example of someone who's presenting feeling really overwhelmed. And so when we think about how do we apply the problem-solving skill in SPR, so we'll always start with a rationale of why do we use problem solving? Why do we think problem solving is an important skill to learn during crises? And the rationale is really about that it can help when individuals are feeling overwhelmed and like things are out of their control. So it's pretty normal. It's pretty expected to feel overwhelmed during a crisis. This is a reaction that many of us have. And problem solving is actually something that we can learn that can help with that feeling of overwhelmness. And so we can present the rationale for helping individuals learn the skill of breaking down problems and evaluating solutions as a way to gain back some of that control, feel less overwhelmed, and ultimately feel more in control and competent around their life circumstances. And so the first step is really around defining the problem and defining the ownership. So defining the problem involves really describing it concretely and in detail. So in this case example of the individual who is feeling really overwhelmed, they might say, you know, I'm working 12-hour days and I can't get any breaks. I'm totally exhausted and overwhelmed. Work is taking over my personal life. I'm missing out on time for myself. I'm not having time with my family. These are the problems, the problem that they're having and the consequences that it's having, the negative consequences that they're having. And so we really want to work with the person to be as concrete and detailed as possible in presenting what this problem looks like for them. And then if it's complex, we want to help the individual learn the skill of breaking it down into manageable chunks so that they can work on it one piece at a time. So in this example, they're breaking down the problem of feeling overwhelmed and working all the time to struggling to find time for their personal life, working 12-hour days, no time for breaks during the day, and feelings of exhaustion. So these are sort of the chunks or the ways that we could separate the problem into kind of concrete pieces. And in this case, you would select the one that felt most approachable at that time, or one that we could make some strides on in terms of using problem solving. And in this case, maybe it's around finding time for my personal life. And then we have to decide, once we've done that and we've figured out what piece of the problem we're going to work on first, we have to decide whose problem is it. So is it a problem that the person is having, or is it a problem that someone else is having? And this is an important distinction, because if it's a problem the person is having, then it's something we can work to solve. If it's a problem that someone else is having, then we need to reframe it as something that someone else needs to work on to solve. And that's slightly different. In this case, what we have is a problem that the person is having. They're having trouble finding time for their personal life. And so then we can work with the individual to be able to set a goal around what are their needs and what are their concerns. And so these are some example statements of ways that we can help the individual determine both their needs and their concerns around this particular problem. So what do they want? They want to have time to do things they enjoy and that bring them pleasure. What do they feel like they need? To get that want, they need to have more time in their day and the week to be able to pursue these things. And what gets in the way? What are their concerns? So their concerns are that they won't be able to find the time, and they're afraid that they'll fall behind at work if they take any time for themselves. So this is a way to help the individual figure out their specific goals and the barriers to those goals. And then you can help the individual brainstorm all of the possible options. So we're teaching the individual ways that, a crucial strategy of problem solving that many of us use, even when we're not aware we're using it, but it becomes harder to do during times of stress, is to really think about all the different possible ways that we can make it better. So write down all the possible options for improving the problem. So in this case, perhaps they could schedule person activities to prioritize them. Perhaps they could talk to a supervisor about what they should do, supervisor at work. Perhaps they could do personal things in the evening and then work late into the night. Perhaps they could end each meeting 5 minutes before the hour to have a little bit of breathing room. And in the brainstorming phase, we're thinking about all possible solutions to a problem, not necessarily just solutions we want to use, not necessarily good solutions, but all possible solutions. And then we would pick one. We would evaluate and choose the best solutions out of the bunch. So in this case, maybe we choose something around scheduling personal activities to prioritize them. And we'd evaluate that. We'd think about what are the pros and what are the cons. So what are the advantages I'd get from being able to do that? And what are the downsides of the cons? So some of the pros might be you'd get to do fun things again and will decrease the stress in the long term. Some of the cons might be you'd have to set limits and it might decrease your productivity. activity. And then really thinking, given these pros and cons, is this a good solution for me? And then, of course, trying to enact that solution. And we would talk at the end of the SPR session on problem solving, we'd be assigning practice. So at the end of every SPR skill session, we assign practice for the individual to do as home assignments or homework. So in the case of problem solving, it would probably look like having the individual choose 2 to 3 problems and work through the steps on their own, helping them think about how they would troubleshoot. How you would troubleshoot that practice. So you'd help them to pick concrete, specific problems and actually schedule a time for them to practice those. And then when they came back in, you'd be reviewing the practice by talking about what went well, what went less well, and what did they learn. And really the purpose of the practices in SPR are so that the individual builds these skills and can implement them on their own moving forward. And so we really want them to get the hands-on practice doing these skills as they're learning them so that they can adopt them and use them going forward. The second core skill is around promoting positive activities. So this is a skill that we really think about using when we're feeling a lot of negative emotions or we're feeling a lack of positive emotions. So we're really not feeling excited about things, we're feeling down, maybe our routines have disappeared or decreased, we're feeling like we don't have a lot of positive activities or positive things in our day anymore. And so the case example that we'll use to illustrate promoting positive activities is around feeling really down and not feeling excited about things anymore. So if an individual is presenting to SPR with this as one of their priorities, and this is one of their prioritized concerns, we might be thinking about the promoting positive activities skill. And the rationale around promoting positive activities is that when we do so, it really can improve mood and our sense of control. So we know that for most of us, going through a crisis really does mess up our routine, and it does make us feel bad. We feel more negative emotions, and it can be harder to feel positive emotions than when we're not in crisis. And so it can be hard when we're going through times of adversity to do things that make us feel good and to do things that are important to us. And so we're on promoting positive activities. We're really focused on helping the individual get back to doing things that are positive and finding new positive things to do. And this ultimately should lead to feeling better, more positive emotions, and also more in control of their circumstances. And so the first step in terms of promoting positive activities is to be able to identify and plan one or more positive activities. So this is just an example of activities that we might be thinking about in terms of really getting creative about ways that we can increase the positives in someone's life, whether it's around creativity or kindness or self-care, those kinds of things. And then the first step is to be able to identify and plan one or more activities. So helping the individual generate these ideas, taking into account some of the things that maybe they did pre-COVID. So what were the things that used to bring them positivity? Maybe it's around exercises classes or picnics, reading books, planning a vacation, and then thinking about how they might be able to do them even within the current crisis that's going on. And it may take some shifting and adapting, but are there ways that they can still engage in some of those positive activities despite the ongoing crisis? And then helping the individual schedule those activities, things that, taking into account things that'll increase the likelihood that they will do them. And then for the assignment, the practice, helping them choose positive activities that they can do daily on their own or with others, and helping them troubleshoot, finding things that are achievable, problem solving any barriers, cost, time, etc. And then having them go out, practice those positive activities, and when they return, talking to them about how it might have affected their mood, what they might have learned, and what do they want to keep doing or add in around positive activities. And that I'm going to hand it over to Emily to take over around managing reactions.
Thank you so much, Michelle. So I'm going to be talking about the third core skill, which is around managing reactions, as Michelle said. You can advance it. So this is appropriate for people that are really struggling with intense reactions related to the crisis. So for example, if somebody is having a lot of nightmares related to an experience they had with COVID, if they're having panic reactions that are interfering with their ability to do their essential activities, so they're, it's stopping them from being able to go to work, that would be a time to use this. If they're having kind of uncontrollable emotional reactions that are getting in the way of their ability to even process what's going on, this might also be a time to use the managing reactions skill. And the rationale for this skill is basically that feeling your feelings helps with reminders. And we're actually going to talk through a case example in which the person is experiencing all three of these types of reactions. So the first thing that you would do with this person, like with the other skills, is present the rationale. And like I said, the rationale is feeling your feelings helps with these reminders. And what you want to do is start off by normalizing these strong reactions to reminders of a crisis. It doesn't mean that there's something wrong. It's a normal reaction. And the idea is that it's important to find healthy ways to feel your feelings about difficult things that happen rather than avoiding them or trying to turn them off to help the reactions get better. And when people use these over time, that can make them feel more confident. It can help them improve their functioning, and it can help them use more effective coping strategies. So the first step in this skill is to identify just what the reactions are and what is bringing them up. So you might start by picking the most distressing reaction and asking the person to pick the most distressing reaction. So maybe this person tells you that the most distressing of these reactions is when they can't stop crying. So then what you do is focus on that reaction and then talk about, okay, so what situations is that reaction coming up in? So maybe, when they watch the news, when they talk to friends, when they go to a morbidity and mortality review, they have these intense crying reactions. And so then once you've done that, so identified the reaction and its triggers, then you go on to step 2, which is teaching the skills to address the distressing reactions. And the first skill that you can talk about is diaphragmatic breathing. This involves encouraging the person to sit in a comfortable position. I like to tell people to put their hands on their belly because what you're going to be trying to make them do is expand their belly as they breathe rather than their chest. And have them breathe in through their nose for a count of 5 while they expand their belly, and then hold for 5, and then exhale slowly for a count of 7 while they say a soothing word to themselves, something like calm, for example. So what I would encourage you to do is practice the skill in your meeting with the person. Another skill that you can teach them is a writing exercise. So this involves having them set aside 30 minutes and plan for that time to write about whatever is distressing to them. So whatever is going on in their mind, whatever thoughts they're having, just write them all down. Some people find it particularly helpful to write them by hand. And what you want to encourage them to do is to give themselves space to feel their emotions, whatever they are, and consider the things that they did in the situation to help themselves or other people. And then once the 30 minutes is up, put it aside, and then ideally plan on doing it again, maybe the next day or a few days later. And the next time they do it, repeat the exercise. So still write about whatever is distressing to them, but try to start building in new and more helpful thoughts about the situation. Step 3 involves creating a plan to manage the distressing reaction. So they know what the reactions are and what's triggering them, and they know some skills to manage them. So now they need a plan to implement these skills. So the first step in this is emphasizing that it's important to really practice good and culturally aware self-care to reduce the degree to which they're having strong reactions when a situation comes up that would elicit one of these responses. So I know we can all relate to this, that when we're not meeting our basic needs, like when we're not eating regularly, when we're not sleeping enough, when we're sick, it's harder to not be a little bit more emotionally reactive. So it's really important to do that preventative work of making sure you're eating and sleeping regularly and taking care of your health needs, like taking your prescribed medications, for example. It's also important as a preventative strategy to regularly do positive activities. So the positive activities, that skill that Michelle talked about, can be useful to talk about here. Maybe plan on doing it in a future session together. It can also be really important to talk to your social supporters about your feelings. And social support is the final skill that I'll talk about, so we can return to that in a second. But again, this is a way to practice prevention around reactivity to triggers by making sure that you're regularly giving yourself opportunities to sort of process your emotions and not avoid your emotions. The next step in creating the plan is to decide what they're going to do to deal with triggers as they come up. So you've already kind of you've done some work to prevent the reaction in response to triggers. Now, if a trigger does come up and somebody does have a strong reaction, what are they going to do in that moment? So what you want to encourage them to do is try to differentiate between the thing that is eliciting the reaction in that moment and the event, the original event. So whatever the crisis or situation was that this reminder is based on. You can also encourage them to use either the breathing or writing skills like we talked about. The helpful thinking core skill, which I'll talk about next, can also be helpful here. But whatever it is, encourage them to have something to go to have a go-to response when a trigger does come up. And this is sort of like if we're thinking about like a fire prevention metaphor, the earlier step in making this plan is, making sure that, you're practicing safety around how you're using fire and having a fire extinguisher handy. And this would be like the fire drill part of the skill. So what are you going to do if there's a fire in the house? You're going to, leave the house, you're going to call 911, practicing those pieces and having that plan in mind. Because when you're in a crisis situation or you're having a really strong emotional response, it can be hard to think about those things in the moment. The next part of step 3 is creating a plan for what they're going to do after the trigger and after the emotional response has passed. And this can be a time to again use that breathing skill or practice some other form of relaxation that feels good to them. This can also be a time to do a positive activity or something that feels kind of healing or otherwise kind of affirming, or like a self-care activity. It can also be a time to, again, talk to social supporters about how they're feeling. So anything that helps them kind of resolve the lingering stress of the emotional reaction. And then, like with the other skills, the work for these and the learning around these is done outside of the session. So it's important to assign an at-home assignment. And so what we recommend is assigning to the person to try both skills in response to a distressing reaction that they experience. And then plan ahead for the distressing situations and maybe commit to trying both strategies or whichever one they want to choose. And then in your next session, you can review. So what happened to their distress? What happened when they used the skills? What did they learn? And I'm seeing a raised hand right now. I'm not sure if we're taking, do we decide we're taking questions as we go, or are we saving them till the end?
I'll take care of that, Emily. You're set.
Thanks. Okay, so the next core skill is around promoting helpful thinking. So this is a skill that you want to use when people are presenting to you with concerns like, I'm never going to feel better. It's my fault. Some of these kind of thoughts that are really negative and are leading to negative emotions, or just kind of unhelpful. So if somebody is expressing a lot of self-blame, a lot of kind of hopelessness in their thoughts, saying things like, my efforts were for nothing, this skill would be really appropriate for those people. So we're going to go through this case example with this person that's expressing a lot of elevated self-blame. So maybe this person's saying, it's my fault that my mother got sick. I should have done more to protect her. And again, you're going to want to start by introducing the rationale for the skill. And for the helpful thinking skill, the rationale is that changing your thoughts can help to change your mood and your reactions. So what you could say to the person is it's totally normal to have negative thoughts related to what happened. So really normalizing and validating that this is an understandable reaction. And then saying, you know, when you have negative thoughts, these can lead to a lot of negative emotions and bodily reactions. And so what you can do together is go through 4 steps to help address unhelpful thoughts, which then can change your thinking and help with your mood and bodily reactions. So the first step in this skill is to identify what the unhelpful thoughts are. So a lot of people assume that painful emotions just arise directly out of a situation. But actually, that's not totally correct all the time. So oftentimes, thoughts go along with a situation that lead us to have painful emotions. And this is evidenced by the fact that 2 different people in the exact same situation could have different emotions because they're having different thoughts. So once you identify what the situation is, ask the person what thought goes along with that situation and emotions, and help them see how that situation leads to those thoughts, which then lead to the painful emotions. The painful emotions don't come straight out of the situation. So in this situation, so perhaps this person is having these unhelpful thoughts or really strong negative emotions when they're seeing a news story about a COVID death. So they might be coming in saying that they're feeling a lot of guilt and sadness. And so what you do is ask them, you know, what are the thoughts that are going along with those emotions of guilt and sadness? Like, what are you telling yourself when you're feeling guilt and sadness? And so maybe this person then says, I should have done more to protect my mother, or it's my fault that she got sick. So once you've identified what the unhelpful thoughts are, the next step is to help the person identify ways to ask themselves questions to come up with other ways of seeing the situation or other ways of thinking about it. So they can ask themselves, what would be more helpful thoughts in this situation? Or my personal favorite is if a friend was in the exact same situation with me, what would I say to that friend? Would I, you know, if a friend came to me and said, you know, my mom got sick and my mom died and was in the exact same circumstances, would I say it was your fault that your mom got sick? Probably not, right? So I think we tend to have a lot more compassion and understanding for other people in a way that more accurately matches the situation than sometimes we have for ourselves. So reframing in that way can be helpful. You can also have the person ask themselves, what do I have control over? Let's see. So this person could say, you know, maybe I did a lot of things to help my mother, and then name those things, or say, you know, I can't control other people's behavior. Okay, so maybe when you have this person ask themselves these questions, they might say, okay, well, I guess I did do a lot of things to help my mother. So then encourage them to name what those things are. And then maybe they say, okay, well, I guess I can't control other people's behavior. You know, maybe I wasn't the one that exposed her to COVID. I couldn't control what she did. I couldn't control what other people did around her. So just helping the person for themselves identify those other ways of looking at the situation. This is much more powerful than just telling the person the other ways of looking at the situation, because when you do that, what tends to happen is people will argue back at you, versus when you have the person ask themselves and then elicit these answers, that can be way more powerful. And then if you continue the next slide, so the one thing that we want to be careful to do here is not have the person come up just with what we call Pollyanna thoughts. So it is no more helpful to tell yourself, you know, oh, you'll be fine, or cheer up, or anything like that. Like, those don't feel any more true than it was all your fault. So they tend to not be very helpful or effective. So what we want people to do is come up with more accurate or helpful thoughts, not just positive thoughts. Because in a lot of situations, the more accurate thought might actually not be that positive, but it's less negative than the awful thing that they're telling themselves. So in step 3 for this skill, what you would want to have people do is rehearse the helpful thoughts. So what they would do is imagine the situation that elicits the thought and then say the helpful thought to themselves out loud. So maybe they imagine themselves hearing about older adults getting COVID, and they say to themselves, I can't control other people's behavior, and I did what I could to protect and care for her. And then what you would want to do next is assign practice of those helpful thoughts. So next time they're in the situation that elicits that thought, and they notice that thought coming up for themselves, have them practice that thought. So when they're out there in the world outside of the session, they hear about cases in older adults and they notice themselves having the thought, remind themselves of the more helpful thought. And just to emphasize this, like with every other skill, we have the at-home assignments. And so what I would encourage you to assign people to do is to try to challenge at least one thought per day. It can be helpful to give them like a cheat sheet of helpful questions, and we have some materials to share with you around this. Sometimes it can be helpful to plan a specific time to practice this skill. I like to encourage people to pair it with something they're doing every day. For example, maybe this is the thing that you do right when you brush your teeth, right before you brush your teeth, because hopefully people are brushing their teeth every day, and that'll be a cue to remember to practice the skill. And then when you're back in session with them, review their practice. So what thoughts did they notice? What new thoughts did they try? And what did they notice happen to their mood? And what we're looking for here is not a total change in mood, but instead maybe a slightly less intensely negative mood. Because it's not going to change overnight. It's not going to be the most convincing thing the first time they do it, but it's the practice of it that over time will help to kind of loosen the thoughts. The final skill is around rebuilding healthy social connections, because I think, as we all know, this crisis in particular can make it really challenging to maintain our healthy connections, and social connections are so important to our mental health and our well-being. So this would be something that would be useful to use for people that are coming in and talking about a lot of social concerns. So maybe they're saying they miss their family a lot. Maybe they're saying they wish that they could do more to help others, but feel like there's nothing that they can do. Maybe they're saying that they're having, they have a lot of needs for social connection that aren't getting met. So maybe they need to talk to somebody when they're stressed, but don't have somebody to talk to. So the case example we're going to use for this is somebody that's saying that they don't have anybody to talk to when they're stressed. And so again, you start by presenting the rationale, which in this case is that if we reflect on our support and our resources that we have with regard to support, that can help to ensure our social support needs are being met. So you start by saying social support can be a really big source of strength after a crisis. And it can be really helpful to reflect on your resources and needs with regard to support. And so what you would like to do together is go through an exercise to help them reflect on this, to make sure that they're getting their emotional and practical needs met. So the way this exercise works is you actually work together to make a social connections map. So maybe they kind of put themselves in the middle and then make lines connecting themselves to all of the people that are important to them in their life, or all the people that they consider social resources, even if they're maybe feeling a little bit distant from those people right now. So maybe this person lists their coworker Jen, their mom Jamie, their friend Robert, their girlfriend Luz, another friend Reggie, and then their sister Kathleen. And then once you have that written out, then you have them ask themselves some questions about the social connections map. So maybe you have them look at the map and ask themselves, who are their most important connections right now? And maybe they choose their friend Robert and their sister Kathleen. And then you have them ask themselves, who are the people in their social network with whom they can share their feelings? So maybe they feel like their sister Kathleen is really the main person that they can share feelings with. Then you have them ask themselves, with whom do they want to be in touch in the next couple of weeks? So maybe they point out that in addition to those two people, they also want to be in touch with their mom and their girlfriend, but maybe they've been less reliably in touch with them. And then you have them reflect on who might need their help or support right now. So maybe their girlfriend might be really needing support. Maybe that's one of the reasons they might not have been as much in touch recently, or their friend Reggie might need a lot of help and support right now. So then finally, once you've had them ask themselves those questions, you want them to consider who and what is missing or needs to be changed. So they've sort of taken stock of the support and said, okay, well, I'm noticing that I only have one person to share my feelings with. And so it probably would be useful to have a second person to share their feelings with. And then maybe they're noticing that they haven't chosen Jen for any of these questions. So maybe it's important to kind of work on strengthening that connection. So based on this evaluation that they've done for themselves, the next step is to make a social support plan. So they're going to reach out to Reggie to support him. They're going to check in regularly with the people with whom they want to be in touch. They want to talk to Kathleen when they're upset, and then maybe reach out to Jen more. And potentially by making these changes, that will help them address that gap in their social support with not having more people to talk to when they're stressed. Because we find that actually providing support to other people can be a good way to strengthen that relationship. And so you sort of have money in the bank, so to speak. So when you need support, that's something that you can draw upon. So the at-home assignment for this one is to basically put the plan into action. So identify their primary connections, reach out to those people and reciprocate. If there's a need for troubleshooting, encouraging them to be creative and specific about changes to make and kind of what to do. And I think this is especially important in our current circumstances because the ways that we call upon our supports are a little bit different now. And then review that in their next session by talking about where the gaps were in their network and what were the things they learned and what do they want to try to do next with regard to their social support. Okay. So those are the core skills. So let's put it all together. So just to reemphasize, the course of SPR is both flexible and structured. So it's flexible with regard to being able to pick whichever of those skills you want to use in a given session, but also there's some structure to the sessions themselves. So you see that you start off the first session always with introductions and assessment and planning, and then you present a rationale for the skill, teach the skill, and then practice the skill together and assign homework. And then in follow-up sessions, you review that homework, you reassess their needs, and then again, you teach and practice a skill, and you complete 1 to 5 sessions as needed for a given person. So in the first session, so again, just to go into this in a little bit more depth, so you're going to introduce yourself and SPR. You're going to do that collaborative assessment and skill selection that Michelle went over. And then you're going to teach a new skill, which involves presenting the rationale, teaching and practicing the skill, and then assigning homework. And then at the end of the session, summarizing what you did and discussing follow-up plans. The follow-up session looks similar in some ways. So you start by reviewing the homework, you do the collaborative assessment and skill selection process, and then you decide whether to use the same skills in the prior session or teach a new skill. You start by presenting the rationale or reviewing it if you're using the same skill. If you're using the same skill, you'll want to apply the skill to a new domain or kind of troubleshoot the existing domain. Versus if you're teaching a new skill, you just go back to teaching and practicing. And then either way, you're again assigning homework and ending by summarizing and discussing follow-up. And then in the final SPR session, you again start with reviewing homework. You review the rationale for all the skills that they learned. You emphasize their accomplishments and all the things that they succeeded in and help them talk about areas where they want to continue to practice and grow. and then talk about what they can do if they need more help in the future, which might be, are you going to return for another session? Are you going to connect to somebody that can help you more in an ongoing way in the long term? Because again, SPR is really meant to be a short-term 1 to 5 session intervention, and some people might actually need more than that. So as an example of how this would look, so session 1, you do the intro and assessment, and maybe you pick promoting positive activities. Session 2, you do a review and assessment, and maybe you again do promoting positive activities. Session 3, review and assessment, and then switch to the new skill of managing reactions. And then session 4, maybe it's just a review and then doing a reflection and relapse prevention. So making a plan for what they're going to do if things get worse. So some final thoughts and resources before we switch over to Q&A. So we've talked about this with regard to how these skills can support your clients, but we also want to emphasize that SPR can be helpful to you as providers. So it can be helpful to you, I think most of us, if not all of us, are feeling, maybe a little burnt out or a lot burnt out. Maybe we're feeling like we could use a little extra support. Maybe we're asking ourselves how we're going to make it through this next round of restrictions. Maybe, we're wanting suggestions to provide our colleagues who are coming to us because they're stressed out. So any of these skills can be used for yourself. So you can make your own social connections map and use that to reflect on your own social support resources and needs. You can ask yourself the same questions, what are my thoughts? What are the emotions associated with them? What are more helpful ways to think about this thing, and then practice those thoughts. You can practice the breathing skill or the writing skill for intense reactions. You can practice the problem solving steps when you feel overwhelmed. So all of these things can be implemented for us as self-care in addition to using them with our clients. And I know that I get a lot of requests, and I think Michelle and Kristen do as well, about, how do you practice self-care? And I feel like this is actually what it looks like. It's not about, taking bubble baths or, getting a massage or something like that. It's about finding constructive ways to feel our difficult feelings and flexibly and creatively problem solve and respond to the challenges that face us. And just like Michelle said at the beginning, resilience is messy. It's not a process where you're just doing everything right the first time and you're coping perfectly with everything that comes your way and you're never feeling upset. It's actually, as this quote says, it's adapting and accommodating rather than being resistant to the suffering. That's what it is to live through hardship for sustained periods of time. It's not that you never feel bad. It's not that you never feel stressed. It's that when you feel stressed or when you feel bad, you keep working at finding new ways to cope with it. And you try some things that maybe aren't going to work out. And that's just part of the process. It doesn't mean that you're bad at coping or that you're not going to be resilient. It's part of what being resilient actually means. And then to increase resilience around you, I always think about the Mr. Rogers quote for kids, feeling overwhelmed in a crisis, that you should look for the helpers. But the way to translate this for us as adults is we should look for the helpers and kind of make it salient when there's people around us that are doing good things and really taking care of each other. But we should also be the helpers ourselves. And the more that we do to contribute to the well-being of others, the more we build their resilience and our resilience. So finding ways to do things for yourself and people around you to make a difference. It can be important to find ways to make meaning, to engage other people, and to foster your compassion. And I know that, it can be, given just so many stresses and frustrations and challenges this year, it can be easy to kind of lose our sense of compassion or have a harder time accessing our compassion, and really making a daily practice out of having compassion for ourselves, but also looking for ways to be compassionate about other people, even people that are doing things perhaps that maybe we disagree with. I think that's really important. And then finally, putting on your own oxygen mask first by practicing the skills yourself will make you a better helper when you're called upon to help other people. So finally, I want to direct you to some resources. Some of these things I put in the chat at the beginning, but there's a field guide for SPR that's available online. There's also a free online training for SPR. We've gathered together some COVID resources along with our colleagues in the Department of Psychiatry that are available at this UW link. The VA, the National Center for PTSD within the VA, developed this COVID Coach app, which includes some similar skills. And then for those of you in the state of Washington, I'm seeing people across the country, which is really cool and exciting. But there's a Washington Listens non-clinical support line and online resources page that we've linked below and provided the number for. And then we also created some handouts and kind of cheat sheets. So there's the skill selection tool that Michelle showed earlier. There's also a cheat sheet on each of the 5 skills plus the assessment skill to just kind of be able to see it at a glance. And then this is what we affectionately call our 2-pager. So it is a little bit more in depth of a cheat sheet that involves kind of outlines for sessions and what you would do to do each skill in depth and kind of what practicing the skill would look like and the kinds of clients that it would be appropriate for. So I think we're right about at time. So I think we should switch over to Q&A. And I would encourage you to put any questions you have in the Q&A section, and we will do our best to respond to them. Thank you very much.
And
Thanks, Emily.
Thank you. Sorry, Kristen, I didn't mean to cut you off. I just want to clarify that by we, Emily means she created these amazing cheat sheets and 2-pagers, and her graphic skills are, I continue to envy them. The more and more we work together. So sorry, Kristen, go ahead.
That's okay. So to get you all started for the Q&A and give people time to type in their questions as they might come up, a question that came through earlier and that I held so that we could answer it at the end is, can you do SPR in groups? And I would follow up with that. If so, could you give a little bit of a feel for what that might look like?
Do you want? I can go, Emily. Give you a chance to recover. Yes, I think you can do SPR in groups. So I do know of some colleagues who are definitely testing out that model. I don't think there's anything in the SPR skills that would be not a fit for groups. It's really focused on building skills and it's individualized, but not so much so that it couldn't be content that would be shared in a group setting. And I think some of the skills really lend themselves really nicely to sort of cohorts of people all working on them together. I think what it would usually looks like when we do SPR in groups is working through all 5 of the skills. So some of that focus on just picking and choosing the skills most applicable to the person probably gets lost a little bit, and that you probably would teach all 5. And some people may participate more in others in certain skills, depending on how much they fit their needs. But you probably wouldn't want to, you really wouldn't be able to skip any. You'd kind of have to do all 5. I don't know if you'd add anything to that, Emily.
Yeah, just to clarify, I definitely agree with everything you said. And by doing all 5 of the skills, that probably would work best doing each of the skills in an individual group session rather than trying to combine them all. I think you could potentially do it either way. I've been doing some groups like this with our level 1 trauma center here in Seattle. They're not explicitly SPR based, but they're very, very similar skills. And we just really emphasize that it's not a support group. So kind of actually discouraging a lot of the kind of intense processing that was what made psychological debriefing less helpful. And instead really focusing on the fact that it's kind of a skills group, not a processing group.
And so another question that's come up is, what is the best way for people to get copies of the charts? And I'm thinking by that, they're meaning the infographics, Emily, that were created. Do you want to speak to that?
Yeah, so I can put the link for it in the chat. I don't know if Christina has linked to them anywhere or made them available online through Sampa, but I will put them in the chat.
Yeah, we will certainly take any resources that you put in the chat, and we'll make sure in our product that's the recording of this and any slides and any other resource links we can link to these as well within the slides.
And the other thing that I would just let folks know is that if you did go to the UW Department of Psychiatry COVID resources, on that webpage, towards the bottom, you'll see something at the end that says General SPR Materials, and that's another place where you could download the skill summary, the cheat sheet, and the skill selection tool. So that's another place that you can find it immediately.
I just put the link to that in the chat. That's, I would say, the main place where you can access the infographics.
I don't see any other questions at the moment. Michelle, you and I had a chat back channel, and one of the things that you had mentioned was potentially talking with, just mentioning for individuals who are already seeing clients and kind of wondering if SPR is something that they could integrate, what that might look like. Maybe for you to take that, and then we can see if any other questions come up.
Yeah, that sounds great. So thank you, Kristen, for reminding me. So one thing I sort of forgot to say, or maybe I didn't make as clear as I would have liked, was that we think of SPR as something that can be really helpful in the context of an ongoing provider relationship. So if you're seeing someone who you're working with in a more traditionally psychodynamic model, if you're a therapy provider, or perhaps you're providing ongoing case management or medication management, if you're a prescriber, if they're having a hard time in the midst of COVID-19 and the other crises that are going on, carving out and saying, why don't we do 6 sessions or 4 sessions or 3 sessions of SPR, this approach that's going to help you specifically deal with the adverse circumstances that are coming up for you right now, is a totally reasonable thing to do. And so you can pull it out and build resilience with people that you're seeing in other modalities, with sort of that explicit communication of, let's take a break from what we normally do and do this approach instead. And obviously you'd skip the introduction part of session 1 if you already know the person. But otherwise, I think it would look very similar in terms of assessing what are their specific priorities around the crisis that's currently going on, the stressors, and then helping them apply the skills. And I think it can be a really useful thing to do to both, as a provider, have something to give them to respond to the increased distress they might be experiencing that seems atypical for them, given your knowledge of them, and give them something really tangible that they can use. So I just wanted to make that point clear as well.
Great. And then last 2 questions that have come up is if you could speak a little bit about how you might approach clients about participating in SPR, and talking a little bit about what you might do if participants in SPR don't do their homework or their practice outside of session.
Great questions. So with regard to approaching a client about SPR, if it's somebody that you're already seeing, I think probably what would be most helpful is just sort of reflecting what you notice. So you could say things like, I know this time has been really hard for you, and you've talked about that a lot. And I know that you said you feel a lot more stressed. You've noticed that you're having a lot of negative thoughts, and that you're really kind of wanting more support than you're getting. And actually, I just learned this new set of skills that's meant for people dealing with a crisis. And, what are your thoughts about maybe trying that out for a few sessions? So instead of sort of like, I think in the spirit of SPR as being really collaborative, kind of just noticing what you see, and then kind of getting their sense of whether this would be a good fit for them, I think would be the ideal way to go about it. Michelle, do you want to add anything to that?
No, I think that sounded good. I think that's absolutely right. And if it's a new client that you haven't, that is being referred to you, I think, again, it's a very similar process of commenting on their reactions during the ongoing stressor and presenting this approach as something that's really kind of goal-oriented in that way, to be able to use. Yeah. And then I think the second question was around homework compliance. For me, I deal with it the same way I do with homework non-compliance in sort of the more traditional individual therapy models that I do, which is around, they haven't done it, doing it with them in session, talking about what got in the way and sort of reassigning it. With SPR, you might also be moving forward with the next skill, but also reassigning the homework from the previous skill that they didn't practice, and sort of dealing with it in that same way of keeping to the contingencies and not reinforcing the avoidance of practice, and sort of restating the rationale around it as well. Yeah.
And you can use the problem solving skill if people are having a hard time doing their homework. So what I sometimes like to do if people are consistently not doing homework is talk about the barriers, like Michelle said, and then talk about what are the pros and cons of doing homework, what are the pros and cons of not doing homework, what are some of the strategies that we could try to address this, what are the pros and cons of trying those different strategies, and kind of have them direct the process of how they would like to address it. And if they're saying, I actually don't want to do homework, I don't want to do any of these sort of exercises, then that is completely their prerogative. But having that be a decision that is guided by them, I think is what's most important.
Absolutely. And I think the one last thing that I would add is that sometimes if there's, if homework doesn't get done in the context of SPR, it might also be that priorities have changed because this isn't a traditional psychological intervention, but psychotherapy, but rather an intervention that's really meant on building resilience. And sometimes what it might be is that the priorities have shifted and that something else is going on and that it's not about avoidance, but just something different. And so I think a lot of that is just really checking in and asking good questions.